Victoria's Director of the Culture, Health and Wellbeing Alliance. She also has a background as a composer, researcher and project manager specialising in culture, health and wellbeing, and was an arts manager for the NHS for 15 years. From 2010 to 2013, she was chair of the London Arts in Health Forum and was the founding chair for the National Alliance for Arts, Health and Wellbeing. So please welcome Victoria Hume.
Hi everybody, thanks Jane, that was a very generous introduction. So I am delighted to be here to be part of this event, it's really exciting. And Julia asked me to talk about the national perspective. So I'm not going to presume to have a window into everything that's happening around the country. We know that this is a huge and very dynamic sector, but I'm definitely going to try and give you a snapshot of what we're learning at the Culture, Health and Wellbeing Alliance at the moment. Just last week, we announced our first national award winners, and I thought perhaps I could use those awards, which are themselves built around emerging themes in the culture, health and wellbeing sector, as a bit of a structure for today. But before I do that, I'll just tell you a little bit about the Alliance, and I'm going to share my screen. So the Culture, Health and Wellbeing Alliance is a free-to-join national membership organisation. We have about 5,000 members. That seems to be growing at somewhere over 100 a month at the moment, which gives you a sense of how, just how much interest there is in this work nationally. Our vision is a healthy world powered by our creativity and imagination. We're an organisation that's driven by the collective power of our members. We cover a huge range of practice, from artists working in hospital settings to community arts organisations to museums to academics, as well obviously as our colleagues in health and social care and local government and so on. We're funded by Arts Council England as a sector support organisation for the cultural sector, but to do that obviously we need to build relationships across health and wellbeing and culture and creativity at a national, regional and local level. So to do that, we have a structure that allows us to reach practice at the grassroots. We have regional champions around the country, an arts champion and a museums champion in every part of England, and we partner with the Lens, or Lived Experience Network, which has its own regional champions around the country, who are helping to put the voice of lived experience at the centre of practice and policy. So here in the South East, the regional Lens champion is Vicky Parker, who I know has been involved in organising this event, and the arts champion is Jo White of Wishing Well Music, and the museums champion is Gemma Channing at the Beanie in Canterbury. In fact, the Lens are looking for directors at the moment, so I'm going to share that link at the end for anybody who might be interested. We also work with 45 strategic member organisations. Those are national organisations delivering culture, health and wellbeing, so people like Paintings in Hospitals or the Museums Association, or Music in Hospitals and Care. And we have strategic partners from NHS England, Public Health England, the Arts Council, National Lottery Heritage Fund and the Local Government Association. That's all quite a lot of information, but really our job is to try to keep the conversation moving around those groups as effectively as possible so that we can help commissioners, policymakers and funders understand the priorities and the nitty-gritty of what it takes to work in this area. So our theme for this morning is inequalities and barriers and ways to tackle that. Well, one of the inequalities is a geographic inequality in this work. And I've talked a little bit about how we're distributed around the country. But another thing I wanted to draw your attention to is this new report from Voluntary Arts called Common Ground. Sorry, that's a bit of a low-res image, but it's a very good report. I'll share the link at the end. It's based on Voluntary Arts' investigation of how creative activity is supported in areas of socioeconomic deprivation across the UK and the Republic of Ireland. And it shows the activity to be thriving in areas that are regularly overlooked by the cultural sector, although that activity is in need of significant support and recognition. In the foreword to the report, the chair of Voluntary Arts, David Bryan, talks about the double impacts of austerity and then COVID, effectively the erosion of civic infrastructure that predated the pandemic, which he says has left so much in the hands of people he describes as community champions. And he talks about these community champions holding together the spirit when everyone else has gone. showed that a sample of 50 organisations were reaching about 100,000 of those most vulnerable to COVID with some kind of creative activity. These are not large organisations. A third of the people in our membership only employ one person. The main message really is that culture hasn't stopped. And this sector has really stepped up to support people throughout lockdown, despite its fragility, despite the precarity of a lot of these organisations. The crucial thing, though, is that almost all of these projects were partnership projects, 94% in fact. And it's the partnership that means that museums can get creative packs into food parcels. It's the partnership that means community arts organisations can reach families through their social workers. And that's the biggest tool I would suggest we have to overcome barriers, partnership. So this is where our awards come in. As I said, these were our first annual awards. We wanted to look at 3 areas that were coming through as themes in our conversations with members: collective power, practicing well, and climate. I've started talking about partnerships, so I'll start with the Collective Power Award. We really wanted to celebrate partnership across different sectors, so not just health and the arts, but as all of you know, often the work crosses over much more broadly than that, with local government, with specialist community organisations, with education. The winner of this award was Daughters of Fortune from Mind the Gap in Bradford, and I'll just tell you a tiny bit about them as one example of what this collective power can achieve. So this was a co-created art and science project exploring learning disability and parenthood, which is an area that Mind the Gap described as almost invisible. And the partners included a university, the NHS, advocacy and learning disabled parents groups, artistic partners, community casts. What really swung it for the judges was the co-design and co-production that informed the whole project, and the way in which lived experience was influencing perceptions and challenging stigma, as well as its reach in terms of audiences. And it's, again, the partnerships that create this reach. Going back for a minute to our report, one of the positives that organisations identified was a new openness to partnerships, a sort of breaking down of some of the old hierarchies. It was also very common for people to say that they'd increased their reach or found new audiences. But it's extremely clear that all this work to make these relationships takes huge amounts of time. And this is time that we really want recognised by commissioners and funders. I know that David and John, who are speaking next, are both very attuned to this issue. So some of you may be following the COVID social study that's being led by the March Network. This is about understanding the psychological and social impact of the pandemic. It involves 70,000 people around the country. And part of it is about how we're all participating in the arts or creative activities. So far, it's really reinforcing what we already know about the arts and health. Engaging in the arts, as well as exercise, gardening, contact with friends and family, all that is very protective of our mental health. Not surprisingly, focusing on COVID tends to be detrimental. In particular, though, arts activities seem to be helping us to regulate our emotions. And the good news is that 22% of us are engaging more with arts, or were engaging more with arts during the first lockdown. The less good news is that 16% are engaging less, and key workers are one specific group that are engaging less, which is particularly a problem given the protective effects on mental health. Building on this, I think Helen Chatterjee may have mentioned yesterday that we're partnering in a AHRC funded research project which is trying to further this understanding, and we're really keen to have more people fill that survey in. So again, I'll share that at the end. Moving on though to the mental health of artists, it's a slightly different story. The benefits to wellbeing don't necessarily carry through to people doing this work professionally. We all know that the structures of the cultural sector, the lack of diversity, the precarities, the difficulties of access don't necessarily make for good mental health. And in this socially engaged practice, there's another layer as well, where practitioners, and I'm sure lots of you here will recognise this, are often in situations where they find themselves feeling responsible for people in all sorts of difficulties, whether health or financial or social. This was already getting quite extreme during austerity, while people were falling through the cracks in social care and mental health provision, and then ending up in community arts contexts without that support structure around them. And it's only really been exacerbated in lockdown. But the Practicing Well Award was a chance for us to celebrate the organisations who are really tackling this and investing support in creative practitioners or facilitators to make sure that we can manage this work as a career, to cope with these complex situations and without burning out. So this was in collaboration with Nicola Naismith, who wrote a great report on this last year, which again I'll share. And our winner here was Plymouth Music Zone, and they've really built practitioner support into the bones of their organisation. I'm sure lots of you here know them as an organisation. The support includes work shadowing, pastoral support, supervision. Practitioners are employed to deliver training to peer groups. It's financially accessible. There's paid time to attend training activities. It's the fact that this is embedded in the structure of the organisation that raises expectations from the creative practitioners who work with them. And that aspect of raising expectations is so vital, helping us to recognise our value, to feel that we know what support we can justifiably expect. Our last award looks at climate. This is maybe a less obvious one in some ways, although perhaps not to people in Brighton. But the climate and ecological emergency is so indivisible from health, whether it's the mental health of young people who are facing climate change, respiratory health in urban areas. And of course, climate change is inextricably bound up with economic and health inequalities. So many of our members take it for granted that climate is a community concern, just as health is. But we really want to make that help make that link clearer and to give organisations the confidence to make joined up arguments about creativity, climate and health. So we're leading a consortium at the moment as part of the Julie's Bicycle Accelerator programme that aims to advance sustainable practice. And our plan for this programme is to use existing case studies to catalyse innovation in the sector, some of which are coming from this awards process. And this was our winner this year, Think and Do Camden Collective. This is a programme that's come out of a citizens' climate assembly, climate crisis assembly in a pop-up community space in North London. And it's brought council planners together with local people, activists with schools, creative practitioners with lawyers. This rich mix of voices and concerns has come together to improve the health and well-being of communities across the borough. And so there we are, right back at partnerships again. The barriers and the challenges to this work, whether it's inequalities across the cultural sector itself or access to healthcare or social divisions or climate, are very real, but it's the coming together that will carry us over them. And I think that's where I'm going to end this morning. Thanks very much.